Hello, it's Bill, the knee pain guru. Looks like I got punched in the eye. Welcome to today's video. Today's Monday, October 7th. Today, we're going to talk about asking better questions, knee pain questions, so you can get better knee pain solutions or answers. We'll be answering questions in just a few minutes. So if you'd like to start typing your questions over in the comments section, that would be great. On whatever topic you'd like to talk, not whatever topic. Focus it around knee pain, pain in general, doctors, diagnosis, physical therapy. Keep it tight in there. So I'm going to do a short presentation, then we'll be answering your questions afterwards. Make sure to like the video, give it a thumbs up, like and subscribe to my channel, and then turn on notifications for future videos. I do these twice a week, where we cover different topics based on the questions that you put in over in the live chat or in the comments after. So we're going to talk today about asking better questions and so you can get better solutions with your knee pain. And this is one of the things I get a lot of questions about knee pain. And a lot of times people are in pain, their mind's all over the board. And they get locked on a bit of information of what somebody they've talked to, or maybe a conversation from a doctor or physical therapist. And then they ask questions, but the questions are narrow in scope. There's this place where, for instance, here's one of the questions. What is the best knee brace to use? Now, do you want to wear a knee brace? In understanding the bigger picture, is this like, are you required to wear a knee brace? Or this is just something your knee doesn't feel stable or you have pain? So the question isn't, what is the best knee brace? The question really is, how do I get out of pain? How do I get out of pain, increase the range of motion? How can my knee feel stable and confident again? That's the real question. But the questions that people come to me with are very narrow in scope. What is the best knee brace to use? Do you really care? Do you really want a knee brace? Because if you do, you can do a search on the best knee brace. You don't need me. And it's important. This was another question I got the other day. Is it good to wrap a Baker cyst with an ACE bandage? That's something you can ask your doctor. But if you want to understand how you can set up the conditions so your body can resolve the Baker cyst on its own, now that's a higher level question. That's going to give you the solution that you're looking for. Do you really care about the ACE bandage? Do you really want to even wrap an ACE bandage? And it was a woman that asked me the question, do you really want to go out? Let's say you want to go out on a date with your leg wrapped in an ACE bandage, or for that matter, have this big swollen thing on the back of your knee. Probably not. So let's focus on the higher level question to ask about resolving what's going on with your knee. Here's another type of question. Not such a great question is, how long should I wait before getting a knee replacement surgery? Do you really want a knee replacement surgery? Or do you want the pain to go away? Do you want the swelling to go down? Do you want full range of motion and mobility back in the knee? That's the question. That is the focal question that we would want to be at, not like, how long should I wait before getting a knee replacement surgery? No rational person wants to go to a doctor and get the bones in their legs sawed off and replaced with plastic and metal. Think about that one. So when you ask a question, look further ahead as far as what is the end result that you want? And this is going to tie into a bigger picture of what we're talking about here. What exercises can I do for arthritis? That's another question I get. So sure, there's lots of exercises you could do for arthritis. You could walk, ride a bike, or swim. However, do you want to set up the conditions so your body can resolve the arthritis on its own? Arthritis being dehydrated joint, pain and stiffness when you move the knee, when you move the leg. So what can we do to set up the conditions so your knee doesn't have swelling, stiffness, achiness, lack of motion, lack of mobility? So we're asking better questions. We're getting you solutions, because if you ask, here's a great one, if you give a kid a hammer, everything's a nail. So if you go to a doctor and ask them, you're in your 50s, you're in your 60s, and you say you have knee pain, you go to a surgeon and you ask them what to do, of course they're going to tell you knee replacement surgery because, well, that's what they do. That's the business model. That is the context you're going to them for. Understanding that your body is broader in scope, more than just flesh and bone and muscle and tissue. There's more to you than that. And what hurts is in the nerves in the knee that are causing the pain. It's important to look at a bigger perspective. So here's some questions. I kind of put these together in terms of better questions to ask for knee pain, if you have knee pain, to get a better solution. How can I eliminate knee pain and get full range of motion back in my leg? What can I do to eliminate knee pain and regain full range of motion in the knee? And what this does, when we ask better questions, when you're sitting in front of your doctor or your physical therapist, your qualified licensed medical professional, and you're asking these types of questions, it's going to set the bar higher, a better standard than what you're used to. And that's going to be a game changer for doctors, because the doctor, their perspective is very narrow in scope. They're looking at the knee and the knee solely. They're looking at what you talk about that hurts. You know, as well as I do, that, knee bone's connected to the hip bone's connected to the thigh bone. That song, it goes all the way up and down the body. And that's what happens. We can't just look at your knee and say, well, if we fix the knee, the rest of the body isn't impacted. So in understanding how to ask better questions, there are solutions that will be presented because the questions are better. And to be honest, there's a two-part piece here. There's understanding that a lot of what we're asking in these questions is outside of the scope of what medical professionals are able to offer, are able to help with. So there's that piece. I have friends that are doctors that are like, geez, I don't know what to do for some of my patients sometimes. And the doctors get to be the be all end all, like they need to have all the answers, and they don't. So there's that perspective. And then there's this other perspective that there needs to be personal responsibility and accountability on the patient's part to take the ownership of what's going on in the dynamic, in their own healing, that there's some things that they realize, oh, geez, I'm not going to be able to go to the doctor for this type of answer. I'm going to have to find it on my own. So there's a dynamic that it's not just doctors are bad because they're very good at what they do. Something's broken or torn, they're the people to go to. If nothing is broken or torn and we're dealing with pain, pain can be felt on a lot of different levels. And this is where personal responsibility, asking better questions, beginning to develop the dialogue in order to figure out what is the solution. And remember, you have the power. You can walk out or stop going to see anyone at any time if they aren't helping you. And I believe that's really important. Empowerment, understanding that learning and growing is part of the process. And you could say, hey, no, this doesn't work for me anymore. I'm going to go see somebody else. Okay, we have a few people on the line here. If you have a question, please ask it about knee pain, doctors, physical therapists. Everybody's probably like, oh, I don't want to ask a bad question. It's okay. I'll coach you through it. I just want you to start thinking about it. Sometimes concepts that are presented initially aren't to be grasped initially. When I was in judo, before my knee injury, my instructor, my sensei, would give me something to work on that he knew I couldn't do that day. But what happened was I'd try it and I'd screw it up. And then I would sleep on it and I'd think about it. And I'd come back later that week or the following week. And then what he presented to me, I was able to do. So I want you to be gentle with yourself and understand it's a process. This is a process. This is a road that I've been on for 21 years. I never thought that I would be sitting in front of you when I blew out my knee 4 times, dislocated it 4 times. I didn't think this was going to be what I'd be doing. But hey, 21 years later, here we are. Let's see. Okay, your next step. You want to do something. You're like, hey, Bill, now what do I do? Great. You can head over to my website, thekneepainguru.com. You can get on my newsletter list. I send out a daily newsletter that talks about knee pain, insights, tips, and tricks, and things like that, and help understand that better. I also have an October coaching special. This is October 2019. That is, we work together for 2 weeks for a minimal amount compared to what I normally charge my private coaching clients. So it would be an opportunity to get in and begin working to start moving you down that road, getting you some results in your knee, in what I'm talking about, that bigger picture, the dynamics that we want to create in your body, and it all focuses on comfort. Okay. Don't have any questions. We got a couple people on here on the line. I'm not seeing anything pop up. It is not a big deal. Remember, give the video a thumbs up, like and subscribe to my channel, turn on notifications, share this video with your friends, especially those that limp. They will thank you for it. Okay, this is Bill Paravano, the Knee Pain Guru, going to sign off for today. Have a wonderful day, and I will see you on the next video.